You know, life isn't made for pain. Life is for living. Don't let joint, back, or orthopedic pain keep you from doing what you love. Get back to what matters, because this is living.
Oh, hello, everybody. What's going on? My name is Nik Walker. It is nice to be here with you today on Playbill Video. I am an actor on Broadway. Was at the time of the pandemic shutdown, was leading the cast, and still leading the cast of Ain't Too Proud, The Life and Times of the Temptations as Otis Williams. Before that, it was 3 years as Aaron, jumping off the tables and shooting Hamilton. It's a whole thing. But I am so pleased and excited to be kind of leading this wonderful panel today, talking with these amazing doctors from Rothman Orthopaedics. We have Dr. Melody Ruvish, a practicing physical medicine and rehabilitation doctor in New York, and Dr. Meghan E. Bishop, a fellowship-trained orthopedic surgeon specializing in sports-related injuries of the knee, shoulder, and elbow. It is so lovely to see you both. How are you doing today? How are things going in this crazy COVID time?
Hey, Nick, it's so nice to see you. I actually saw you earlier this week. You had a few cameos, you know, maybe in front of Macy's and in front of a kind of scary tree. Yeah, you sound pretty good.
Well, and this is why I'm so excited to talk to you, because we did Macy's Day for Ain't Too Proud, and we also did the Christmas tree, as you said, and we have another one coming up. So I'm in a show right now, which is like easily, you know, I was never trained in dance. I was a Shakespeare major going to college. The show that I'm in currently is like physically an insane show. And so like the chance when they were like, the chance to talk to two people who like can help you take care of your body, I was like, that sounds amazing. And I think all of us kind of in the Broadway community are always looking to hear more about what it is that you do, because you guys are really the people who keep us up there, keep us safe, and keep us going. So just happy to be talking with you guys today. So if you don't mind, let's just get right into it. Just in terms of, the performing arts in general, right? As artists, we have needs that are specific to the shows we're doing. For Ain't Too Proud specifically, it's, I know that we're dealing with a lot of lunges. There's like all of our knees are just like, I bought the Normatec boots, and I'm using those every night that I'm in the show. Like it's all quads and adductors and ITs. But this leads me to this question, which is, how would you specifically treat a performing artist when they come to see you? What makes treating a performing artist different than, say, a basketball player, say a football player? What kind of are the differences there? And either of you, please.
I can start, Nick. Thanks for the question. That is a great question. We obviously, as orthopedists, treat all sorts of different athletes, from performing artists, basketball players, and everybody presents with different types of injuries. One thing I would say that's different with treating performing artists versus like basketball players, a lot of these injuries we see with performing artists are going to be kind of a more chronic type overuse injuries. We see less of like the acute ACL tears or kind of like Achilles tears, things like you would see when watching a basketball game. So a lot of the performing artist injuries are developing over a long period of time, because you guys are performing the same types of activities pretty much every day, all day long, for weeks at a time, for months at a time. So you're going to develop your overuse type strains, tendinopathies, and injuries like that. So we take that into account when treating you guys, and we know that we need to keep you able to perform, even if you're, in some kind of type of discomfort. The goal is to keep you on the stage and being able to perform without much discomfort, with the knowledge that, you have tough schedules that you've got to maintain. And we'll do everything, to keep you up there and healthy at the same time. So it's kind of, it's a group effort between the doctor, between the trainers, between, the performing artists, and the physical therapist, really to optimize treatment for a performing artist and meet your daily needs.
So, I mean, that's amazing, because it really, I mean, what comes to mind is the fact that you guys are almost in a way like detectives, right? Because you know that we're doing the same movements day after day. It seems like your job is to kind of get in there and be like, okay, but what is the thing that is giving you the trouble right now? How do we find it? How do we zero in on it? And how do we heal it? So the question for you, Dr. Hrubish. So, how do you what is that process for you guys? Like, do you, when I, in the sports medicine that I've encountered, like they're asking me about like, yeah, what movements are you doing? Like, where do you start to kind of go on that journey with them to find those answers?
That's the fun part. So, it's easy to say my knee hurts, and we can say, okay, your knee hurts because, your kneecap might not be tracking well, but why isn't your kneecap tracking well? And what else is going on? And maybe your knee doesn't hurt until like the second show on Wednesday. Maybe you're good through the first part of the week and you start to break down. Those are the things where you really want to see a specialist who can not just say, okay, this is what hurts, but then figure out why. Like a marathoner, they don't necessarily hurt the first 20 miles. They hurt mile 21. If you watch them run the first 5 miles, you're not going to catch anything. You really have to see how you're using your body when you're in that area. And another thing is that, you're doing this 8 shows a week in your chosen profession, and there are a lot of other people that are doing that. You have choreography, and that tends to not be symmetric. So we try to always do what we do to help you stay or maintain your body at its peak performance when we know what you're dealing with. And that's kind of the nice thing. The difference between sports and Broadway is that sports is very unpredictable. You actually try not to let your opponent know what you're going to do. But the nice thing is you jump off the table every time, right? Or you're falling to your knees the same way every time. So we can predict that and maybe help you do that more safely and more controlled, so that it might look still great to the audience, but it's not as impactful on your knee or that sort of thing. So that's the kind of fun part. We can help you choreograph that.
Well, and it's so funny you said that, because one of the things I was thinking of is like, have you guys ever been in a situation with the creation of a show, right? Because I feel like these are things that we could be doing from the first time we get in the rehearsal room, looking at ways to kind of, okay, I know that you want this. How do I do this safely? Like when you find that performers come to you guys, is it often after the show is running, or is it in rehearsals, or both? Is that like, do you guys kind of find that it's either way?
Well, usually it tends to happen when something is irritating. Like let's say you're pushing a wheelchair on stage, and the big wheels make you look nice and dainty, but they really irritate your shoulder. So that's something that usually the people that are in props, the people who are making all of your costumes, and even the people that are forming your shoes, they all think about that. They're all worried about that for you. They know you're going to be wearing those things and using those props. But certainly if they want you to jump off of a table that's 5 feet every night as opposed to 3 feet, they think about those things. So they tend to bring us in when something maybe isn't helping, and then we can help troubleshoot. But you really, like Meghan said, you have such a good team around you. We just sort of add a separate perspective. It's not like we're needing to initiate things so much as maybe help problem solve with your team that's already in place.
So let's get a little more specific about that problem solving. So I want to talk a little bit about the biomechanics optimization for performing artists, and specifically how you guys go in and address what is wrong and why it went wrong. Like what so now, somebody's come in, they say on the 3rd or 4th show, it's feeling like this. What is the treatment plan? How do we treat it? How do we prevent it from happening?
So, I mean, that's a great question. It's kind of the crux of what we're trying to do to keep everybody healthy. So, it depends. Say the performer is having pain mostly in the right hip, and we kind of zero in on that. So in our examination of the patient in clinic, we're going to ask questions about the clinical history. At what point of the show is it bothering you? What motions are bothering you the most? And as like Melody said before, is it during, the 3rd or 4th show of the week, or is it bothering you the entire time? Did it occur on an acute type event, like, a jump or something like that, and you felt something pull, or is this something that's kind of developed more gradually? So using those kind of cues from the clinical history are kind of where we start. And then in clinic, we usually always get imaging of patients. So if patients coming in with right hip pain, we'll get a right hip x-ray to start with, just to make sure, especially in performing artists, things like that, that there's no evidence of any kind of stress fracture or something like, more major that could be a more serious injury. And then, and at that point, the physical exam is very important, comparing symmetries between sides, looking for any biomechanical differences that could be overloading that joint compared to another. So, specifically in, the pelvis, sometimes, people describing on right hip pain will have very tight hip flexors, and that can end up on overloading your hamstrings. There's a lot of cues that we look for that we can kind of tell, be able to help guide our treatment. And then, eventually, if it really does seem like it's a more serious injury, we'll send a patient for higher imaging, like an MRI or something like that, really to get down to the crux of it. But, a lot of it we can tell just based on clinical history, or physical exam. And then, the whole biomechanical chain is related. And once we kind of get down to the crux of the issue, working with a physical therapist to kind of narrow down those exact movements and, try to work through strengthening and stretching and things like that, and modalities to be able to make it, the injury improve over time.
I love that, Dr. Bishop. And it really, personal for me. So when I was in, doing Hamilton, the, like you were saying, Dr. Rubish, the jumping off the table, that was every night. Room where it happens is that table jump. And the thing is, it's this kind of thing that you do in rehearsals and you're like, oh my God, this is amazing. It's such an amazing moment in the show and blah, blah. But then you remember that you're 6'2" and you got to do it 8 shows a week. And and also we're not, I think that the other thing is, I'm not coming from sports. I had to kind of learn, fitness to be a part of this industry. So in terms of landing correctly, I'm landing with straight legs for just not thinking to squat, So it really is these types of things. I guess all this to say, my question to you, I remember the first time I got injured on that show, there was just such a fear. Do you know what I mean? Because your body is your vessel, and what I loved about the sports medicine doctors who I've worked with, you guys just have such a way of kind of caring for our anxiety when it comes to that. And Dr. Bishop, I'd love to hear a little bit about kind of that side of it too. I mean, how are you making space for not only the physical thing, but also the emotional toll? Because it really is an emotional thing to get that jolt of oh my God, it's not working like it's supposed to. You know what I mean?
For sure. And I mean, a lot of us that go into sports medicine go into it because we were athletes ourselves. So we completely understand the emotional and the connection and the importance of, being a performing artist or, performing in your sport and staying out there and staying healthy and performing at your best. So personally, I'm a long distance marathon runner and I've done that my entire life. And I've experienced a lot of overuse injuries, just like performing artists have. And, I can certainly relate and empathize with my patients that have had injuries in the past. So I definitely use that when I treat my patients. I know how important it is to be able to stay out there and stay healthy and want to push through injuries and want to push yourself to the limit. So I can take that into account when I treat my patients. But, also on the other hand, you've got to know when you're kind of at the point where pushing yourself through an injury is going to lead to other problems, possibly overcompensation type problems and an injury elsewhere. So it's kind of that appropriate balance of, wanting to stay in the game and stay active and push yourself to, new limits, but also, knowing the appropriate time to step back and take rest and allow yourself to kind of emotionally connect with that too.
Yeah, Dr. Rubish, I would love to hear from you a little bit about that, about knowing that moment, right? Because that is just a very fragile moment when you're the moment when you have to tell someone hey, I don't think this is the injury that you work through. Do you mean I think this is the one that you take a step back? So what gets you there, A, and B, how do you handle that moment as the person who has to tell them hey, whether it's a week or 6 months, we need you to slow down?
Yeah, that's a really good question. And it sounds like you've been on the other side of that conversation once or twice, which is devastating in that moment, especially when you worked so hard to be where you were. So, we really try to focus on what can we do to help you heal as fast as possible and correctly, And then it's not just that, it's let's prevent this from happening again. So let's shift our focus from what we can't do now, and let's focus on how we can use your energy positively. So let's say, it might have been something that you just did incorrectly, or might have landed incorrectly, or somebody wasn't where they were supposed to be. Then what we can do is take that time and help work on your foundation. So let's say you dislocated your shoulder, and that's going to take some time. You really have to be careful with that so it'll heal correctly and you won't have long-term problems. Well, let's work on other things so that your shoulder is more stable when you go back. And let's also work on your scapular biomechanics and your posture and how you hold yourself. And so it's like with a runner with a stress fracture, we can still maintain your aerobic fitness. We can do all these things to work on the foundation so that when you go higher in your high level, you're working at your top percentage of your potential. You're better at it. You might be faster at it. You might have more breath control when you do it. And so it's not that it's still devastating, but we talk about how do we use your energy positively, because it's so much the mental health. But like you said, your strength is not necessarily the dance. Your dance just gets you around the stage because you're an amazing performer in other ways. So let's focus on that. Let's take some time to have some vocal rest, to work with some coaches, work with your trainers, those sort of things. And then we can also talk with the rest of your team, like whoever's traveling with you backstage. If you have somebody, if you have other people that work with you, let's bring that in. And there are also specialists that work with the mental health portion. So when you are unable to do what you do, then we can work with that too. And we know that's a problem. And so we try to maintain your mental health as much as we can so we can get you back as part of the team.
So let me ask you this, because it's so encouraging to hear from both of you, just the amount of detail that goes into treating a performer's injury, right? Again, fragile, but to know that you guys are caring for it like that. So back to you, Dr. Bishop, with these is this something that when you were trained, when you're in school learning about this, are they teaching you about, when we're talking about biomechanical optimization, are they teaching you that everything is connected? Or is this just something that you come upon by working with athletes, with performers, that you're realizing, oh, I can't just treat the actual injury. I also have to keep them going and strengthen this and try this. Does it just kind of come organically like that? Or is it really kind of part of the curriculum?
100%. It's mostly comes upon with experience, but we definitely have that as part of our curriculum, with learning. But the more you work with athletes and performing artists and things like that, the more you learn really just from experience and, from seeing more injuries and seeing more types of kind of biomechanical issues. That's how you learn. And you learn from self-experience too. I mean, I've definitely learned a lot about injuries just from my own personal injuries too. So a lot of it is kind of like the real life learning that continues every day in medicine and in most fields. But some of the stuff they can prepare us for in medical school, but until you've really lived it, and I'm sure most people feel the same way in their professions, you're going to learn more skills and better ways to treat and keep patients healthy in the future.
Mm-hmm. So on that topic then, and this either one of you, please feel free to answer. So when, let's go to the opposite end of the spectrum, right? You have the person who needs to sit out for however long, but then there's the person who is working, who's like the injury, maybe, I don't, and admittedly don't have the language for this, but the injury isn't such that they have to stop working, but they do have to be mindful. So, without naming a specific injury, what are the kinds of things you're telling this person in terms of doing the show, but also being wary of this thing that's not at 100% right now?
Yeah, we call you guys the walking wounded when that happens. So you're wounded, but you're still doing what you have to do. So yeah, that's certainly something. And what as a performer is you could be on the stage alone, but you're never by yourself. There are so many people in the wings. There are people behind you. So you have to bring the team into it. And a lot of this is communication. And like you said, you don't have the words for it because you might not have had to deal with it, especially if it's your first injury. That's why you come see somebody who knows how to do that, how to communicate with the company managers, how to communicate with your backstage whoever your medical help is, who can help you. If you're on a traveling show, it's even more complicated because your local team changes every couple of days to weeks, depending on how long your sit is. So that's the sort of thing that we can help take some of that stress off of you. It's a steep learning curve, and we try to make sure that we educate people so that they can take control and they can advocate for themselves. But it's an entirely different way of looking at things, so we can help with that.
And additionally, when patients are training through, sorry, go ahead. I was only going to add, sometimes training through injury, a lot of athletes and performing artists really know their bodies very well. So, sometimes that's trusting in them personally to know whether or not they're sustaining an injury that they can keep performing through without really making things worse or making things get to a point where they really can't recover well from it. So, that's a good conversation to have with the doctor and with the performing artist, just to make sure you're on the same page. And additionally, in order to keep people performing, at the level they need to be, there's things that we can do to help even in situations where they're injured, making sure, they're continuing doing strengthening exercises and physical therapy exercises during the performance, when you guys are not actually on stage, making sure, you're staying up with stretching, foam rolling, massage, ice, like things like that for the injury every day. Sometimes, giving an injection can be a useful thing to be able to get through kind of an acute period of pain, at least until you're able to get to a point where you've got time to rest and fully recover.
I want to ask a question that is so personal to my experience, but I have to ask it because I'm like, talk to me about dry needling. Is that a thing?
Melody, that.
Like, Melody, talk to me, because here, and this is why I asked. So again, I think that one thing that I found was that my hip flexors were tight, right? They were tight. And it wasn't like, the PT that I had on Hamilton Tour and actually Hamilton Broadway, both of them were two of the best PTs I've ever worked with in my life. And I trust them with my life. I literally was like, yeah, you guys are, and if they're watching right now, I hope you heard that. I trust you guys like wholeheartedly. Dry needling became like, I strangely loved, and I don't know if that's like a good thing. But it wasn't, we didn't use it often, but when we used it, it was just like a good quick fix. Right. So is it something that is useful? I've heard kind of both things, that like people who don't recommend it, people who do, like, and also please explain what it is, because I'm being terrible and not explaining what dry needling is. So yeah.
Yeah, Megan punted that one to me because I do dry needling frequently. Especially,
she's done it on me before.
Yes, there we go.
I wasn't going to share that one, but yes, it can be super effective. But like any intervention, it needs to be correct. It needs to be used correctly. So like you said, sometimes you wanted to get it done and maybe it wasn't the right move. And I might have known some of the people that were needling you, and that's a very common thing to do. The thing about needling is that it can help when you have those muscle restrictions. So for those of you who might not know what we're talking about, we say dry needling because we stick the needle into an area like a trigger point when part of the muscle is restricted and not allowing the muscle to move completely. It's not appropriate when the entire muscle is in spasm, but when most of the muscle is trying to work and you just have a few restrictions, then we can use this dry needling to try to mobilize that restriction. I call it a party trick because it doesn't fix the problem. It doesn't fix the cause of the problem. And it tends to not work well in isolation. Athletes love it because you get a bit of an endorphin rush and it does release right away. But like when I used to work in college athletics, my athletic trainers knew I would not dry needle our athletes unless the athletic trainer told me that athlete was showing up for, like Megan said, they're exercising, they're rolling, their myofascial release, all of that, because that is what is actually addressing all of the biomechanical optimization that we need. And then the needling can be a bit of it can be helpful to kind of jumpstart that. Or like you said, you might have, when we think about an injury, there's two things to think about. Did you get injured because you weren't doing something right? Like the system wasn't perfect? Or do you have a perfect system and you're just overloading it with 8 shows a week, 52 weeks a year, and you're not there's a reason that you might be breaking. We have to talk about that. So sometimes what we do is we use that needling to sort of get you through, knowing that it's only adding to, it's just one of your things, like your boots, right? Your recovery boots, that's not all you do, but it's a great addition. And then like Meghan said, you are the expert on you as a performer. So we're always sort of listening and asking and trying to get you to give us more insight into how your body responds. That's one of the nice things about having somebody who knows you do the needling, because everybody responds differently. So when I needle, it's not a single intervention. I try to do it like once a week for 3 to 6 weeks, strategically combining it with myofascial release and other things so that it's the most effective.
I'm so glad that you spoke on that, because that's why I love my PTs, because they were like, yep, this is not the thing. This is one part of the thing, and we're doing it for a specific purpose. And there were days where I was like, oh, I think I need it. And they're like, no, you don't need it. You know what I mean? Like knowing those boundaries, and trusting your body. I think that's the other thing, that when you do the work that is like not the fun work, right? Like I think somewhere in here I have it, because I literally just got off a plane. Yep. So this, right? Two golf ball, buddy, has saved my life. I do this under my feet. I use it on my ITs. It really, like, because it's not fun. Like, yeah, it sucks to have to get in there and like really just dig in there, but that is what needs to be done. And the way that it was explained to me was like, yeah, then we can do something like a dry needle every once in a while, and then you take an Epsom salt bath. Like, it's a whole system. You know what I mean? I love that you said that. Okay, so
point out, Nick, that you're actually, what you're doing there is taking responsibility for your own body and doing a lot for you, which is I think that's an important maturity level as performers age. Then instead of things being done to them, they're active participants. So I love it when performers are able to do some of their own myofascial release, because that exactly how much pressure to use, and kind of when you hit that sweet spot. So that actually augments anything that any medical professional can do for you. So that's an important step.
And we actually have a question here. Is dry needling the same as trigger point acupuncture?
Oh, so that's a good question. They're similarly spoken about, but there are differences. So like we said, dry needling is using a needle to go into the trigger point itself. I call it it's kind of the down and dirty, go at the spot that's restrictive. Trigger point injections are when we actually use something in the needle at the area. So that's like saline or lidocaine, and those are different. We use them for different reasons. Acupuncture, the idea of acupuncture is energy meridians. So that's how you can, touch a place on the ear and you feel it in your hand or something like that. So it's not as direct. So when we do needling, we really just go at the restriction. But when there's acupuncture, then they're using needles, and they're often the exact same needles, but they're thinking more energy meridians and how that flows through your body. And again, like Nick said, the interconnectedness, everything is connected. So people find what works for them, and then that's what we tend to go at.
I love it. And I just want to make a point. I am using the peanut to roll up my foot right now. Like, that's, you guys just have me on this train. So thank you for that. That's what you got to do. That's what we got to do. So let me ask you this, because right now, we're in this period where definitely for athletes, certainly for Broadway, right? COVID has impacted all of us, and we're sick of talking about it. We're here, but this is where we are, and we have to learn to live in this world. So my first kind of COVID related question with performers is, is there a certain type of injury that is maybe increased with performers in COVID times? Dr. Bishop, I would love to hear from you. Is there any kind of pattern that you're seeing right now since March or really February of 2020?
Yeah, I mean, a lot of the injuries that we've seen, kind of extrapolating this to professional sports and things like that, just because they've gone back from kind of the lull period into competing again after kind of a long delay, is a lot more kind of acute muscle strains and tendon tears. Like looking at like, say, like the NFL, the first couple of weeks back of the season, without having a preseason and not having kind of like the appropriate practice that normally these athletes would have. There's tons of like hamstring strains, a much higher level of that. I think in like the second week of the NFL, there was like 7 ACL tears, which is definitely a higher number. So kind of predicting like once Broadway kind of opens up again, just without having the typical kind of lead time, presuming if you don't have the typical lead time of practice as a group and things like that, I would expect to see kind of more muscle strains and things like that. And, the importance, this just kind of shows the importance of keeping up with your physical stamina and, your physical therapy routines, your strength routines all throughout this time period. Just to be able to help with injury prevention once you're back to your normal routine and normal performances.
So Dr. Hrubish, let me throw it back to you then on that topic. Is there, obviously as we start to look at coming back and, there was, articles coming out, people are being a lot more optimistic about Broadway's return, and it's a wonderful thing. But on that topic, what should performers be doing now to prepare for reopening? And that's a question that was actually brought up in this. But part B is, in terms of bringing these shows back, is there a conditioning that the group should be doing? Is there a pre-show, pre-rehearsal kind of conditioning that we might want to look into so that we can rebuild this stamina that we, just by necessity haven't been using in that same way?
Absolutely. Yes. So the difference, I think, between performers and a different athlete, like a soccer player or a basketball player, is you don't just have to get across the field or across the stage well. Performers have to do it beautifully and often singing. So you can't be short of breath, and you have to be able to your turns have to be on. You have to hit your mark. Somebody's coming right after you or going right in front of you. So those things, you can work on a lot of that by yourself. So runners have to have great aerobic fitness. So, running, swimming, cycling, things that get your heart rate up, and you can sing while you do that behind your mask. And, people might not pay you for the ticket, but they might enjoy the show. So those are things that people can be doing on their own. You got to work with your personal trainers, your physical therapists. There's a lot right now, because Broadway is not in session. There are a lot of things I'm doing with my performers that they have the time to recover from that we wouldn't normally if we were trying to get them back out on tour or back on stage, because there's only so many swings that can cover, and if a swing is on there is covering for them for a 6-week stint, then that kind of leaves the rest of the swings shorthanded. Then right now, because there's not the urgency to get back on, we are having the luxury of time, which is never the case on Broadway or in performances. So we're really taking the time to do some of those maybe regenerative procedures, things that require a total shutdown to be done correctly. But yeah, take the time to work with your vocal coach. You really have to be doing your maintaining your aerobic fitness. And like Meghan said, the flexibility is very important. So making sure your yoga or your Pilates, all of those things are on point. I know some people were joking for the Hamilton doing Macy's. They were like, "Will my corset fit right now?" You have to think about that. Are you going to fit into your costume? These are, there are people who are having kids right now, which is amazing that they have the time to do that, but they're expected to be able to jump back into performances. And people who do give birth, that's a pretty violent procedure. And then you're supposed to be jumping right back into performing. Why don't we take some time to work on your body to make sure it's back into performing shape before you need it? Like for college athletics or performance, like professionals, we would never say, show up to practice not having done your homework. You're going to die during your 2-a-days. We know that. So plan on being ready, because we're hopeful it'll happen.
Yeah. Yeah. And that's my victory of 2020 was when I jumped back into my Ain't Too Proud costumes. Those things still fit And I did not. I was like, I am positive these will not still fit, but they did. So I was like, not, it was great. It was a wonderful little victory. So on that topic then of kind of getting back into that shape. I mean, with that, is there any kind of injury, and maybe what you just said is the injury prevention, but is there any injury prevention that we can kind of be keeping in the back of our heads as we go back into this? Like, what are the injuries that come when you're restarting the train? Do you know what I mean? Like when is it kind of Dr. Bishop, as you said, with these strains and things that you're seeing, these acute things that you're seeing, is that kind of the same theoretically for Broadway performers? You'll see
like a lot of tendinopathies, Achilles tendonitis definitely can be something that creeps up when someone tries to get back into training again. Plantar fasciitis, issues with the feet when you haven't been like really stretching them out or rolling them, over this time period. Having tight hamstrings and just general tightness in the lower extremities. So, for really trying to get into a program that helps maintain your cardiovascular fitness, but additionally kind of works on stretching and strengthening is important. And when we look at, say like ACL prevention for soccer players that are going to go back to a sport, it takes at least 6 to 8 weeks of doing an ACL prevention kind of strength program to really see any kind of neuromuscular adaptive change. So, that's the same type of thing goes for performing artists. If getting back into a regular performance routine, you want at least 6 to 8 weeks kind of a good pre-strengthening program and stretching program to be able to make sure that your muscles and your body is really ready to take on the increased workload.
Mm-hmm. And so this is great because a lot of questions are coming up, a lot of great questions on this same kind of topic. What are some easy things? What are some like tangible things that every performer or non-performer can be doing right now? Because we're not just dealing with the Broadway shutdown, we're also dealing with quarantine. We're dealing with the fact that we're, at least especially in New York, a lot less mobile. So what are things that we can be doing? Is it just like as simple as maybe doing like 10 minutes of yoga in the morning, or is it something, what can we be doing?
Yeah, I think yoga is a great exercise for strength as well as flexibility. Without trying to like give any kind of undue props to anything, I think like the Peloton app is a great like at-home app for home cardiovascular strengthening type exercises and yoga and stuff like that. So like even like doing, home HIIT workouts and things a couple days a week, yoga is a really great way to keep up your fitness and your strength. There's not a lot of like gyms are open again, but getting outside and trying to, brisk walks, runs and things like that, it's a great way to be able to get outside and get good fitness into. But kind of varying your workouts so that you're both getting a combination of strength as well as a combination of cardiovascular fitness.
Mm-hmm. And Dr. Rubish, let me throw it to you, because with this next question, I actually love this. Somebody was asking, how do we do things safely while avoiding repetitive stress injuries? Because I do a lot. So basically my workout is usually 4 days of, it's a 30 to 40 minute HIIT and then like some sort of strength. Right. But what I've been finding, just because I'm 6'2", and I've been doing this, I've really been trying to modify so that I'm not going hard. It's a lot of there's only so many burpees you can do before you start to hurt all over. So that's kind of my question to you, Dr. Rubish, is what are the things, that we can do? How can we do this safely to avoid these stress injuries? Is it okay to modify in some of these instances?
Yeah, for sure. One way to make sure that you're not overdoing it, somebody would think about maybe a stress fracture. You need to ease into it. So let's say somebody has an injury. We wouldn't say, okay, go run 10 miles for your first run. We would say, here's our return to run program. I actually worked with some physical therapists. We developed a return to dance program. So after an injury, how do we safely get you back to dancing? So those exist, how to, get back into things. This is a chance for you to work on your deficits. So if you tend to be on the tight side, then maybe yoga is a great addition so that you can work on that. That doesn't take a ton of space. Sun salutations, you can do those on your bed if you need to. Another thing is be aware of your environment. So if you're doing a lot of jumping on concrete, that's very hard. So maybe try to find like a foam or something you can just place so that you're making it a little bit easier on your extremities. Another thing to think about is your shoes. So how you interact with the ground. If you're doing a lot of lifting, then are you wearing wrist protection? These are things that you can do to make sure that what you're doing is safe, even though you might not have access to all the equipment that you typically do. I mean, for singers, if you get injured and we're trying to maintain your fitness, I throw you in the pool because that breath control is amazing. Well, in New York, a lot of our pools are closed, so they don't have access to it. So think of other ways for breath control. That's a great option. But like Meghan said, there's a lot of free online options too. I mean, I think some have like maybe some introductory rates, and that's a great way to maybe not spend a ton of money on insight into what you can do to stay active. But I would focus on aerobic fitness. I would focus on muscle strength. I would focus on flexibility, and I would make sure you don't neglect endurance. So you might be able to do, so like when you do your HIIT workouts, your first 10 minutes, you might look really pretty in the mirror, but once your form starts to suffer, then you really got to stop, because that means that you are compensating, you're using muscles that you probably shouldn't be using. And once you're done with that, don't forget how important it is to have a good recovery. So we think about a dynamic warm-up and an active recovery. So you wouldn't just jump on stage and start singing. You'd do your vocal runs. Same thing with running, same thing with jumping, same thing with dancing. So think about your warm-up and your cool down and build that time in. You always have to make sure you don't neglect that.
And that goes to this. Somebody was asking, when I think you guys kind of inadvertently answered it, how do you think the long layoff will affect performers, road back to 8 shows a week? But I think it's exactly that, right? This idea of starting to, we can decide how it affects us, right? We start incorporating these things now. I want to end on this question because it's something that I want to, if there's anything I can do, to encourage performers who are in this COVID time, as we all are, to continue to see their doctors. And I know that it's scary out there. I know it's scary to leave your house, but if there's a problem, if you're feeling like there's something that you don't understand, the great thing is we live in this amazing city with these amazing professionals like we're talking to today. And I wanted to just ask you, just how is Rothman maintaining their orthopedic treatment plans despite COVID concerns? And what are you guys doing to kind of protect patients and make them feel safe during this time when, like, it is a very weird time to be in a space with people, letting them to, very close. Like, what is that for you guys? And let's start with Dr. Bishop, and then we can go back to Dr. Hrubish.
Well, things have certainly evolved since, back in March and April, when this first all started. So originally, back in April, when we shut down all elective surgeries, and essentially we were pretty much 90% telemedicine at that time, just because it was the safest way to be able to continue to treat our patients. Since then, we've, obviously been able to kind of fully expand back to our normal clinic hours, trying to do it safely. We take temperature checks for all of our patients when they come into the office. Everybody's required to wear a mask. Our staff wears the N95 masks, which are a little bit extra protection. And then we space out our appointments a little bit more than we normally would, so we don't have a full waiting room and things like that. So we are still somewhat restricting the amount of patients we'll see, just so we don't have an overloaded waiting room. And then we still do telemedicine visits, which I'm hoping will continue. In addition, I'm a surgeon, so with surgeries, thankfully, elective surgeries are still going on in New York City. I know a lot of parts of the country are starting to shut down again, just due to kind of hospitals getting filled again and lack of PPE. But as of right now, we are still performing elective surgeries, both in the inpatient hospital setting as well as in the outpatient setting. So, most of sports injuries that I take care of are thankfully able to be performed at our hospital surgery centers that are in an outpatient setting. So patients don't need to stay overnight, and everything's done very safely in terms of COVID. Patients are pre-op tested. Everybody has to be negative for COVID prior to getting a surgery and things like that. So, we are still operations as is. We're taking care of our patients in the safest way possible. And now is not the worst time, as long as we have enough PPE and resources to take care of our patients, to consider, taking care of seeing a doctor, if you've had a nagging injury, getting an injection, or considering surgery, just because you do have the time to recover at this point.
And Dr. Rubish, any other thoughts on that one?
Yeah, I mean, you really have to go with what you're comfortable with. We would certainly not want anybody to be stepping outside of what they have decided is right for them. But we thankfully have the ability to do things safely in clinic. And the other thing would be, how can you meet yourself where you are to just bring yourself a little bit forward? So do you need to see your massage therapist? Do you need to do a telehealth visit to see, there are ways we can just sort of try to meet people where they are to be as safe as they need to be, but everybody's making their own decisions and we really try to respect that. But the one thing we do, like Dr. Bishop said, we have very strict requirements. If you are going to come into clinic, then you have to play by the rules, and that's mask, temperature check, spacing, all of that, all the cleaning that we do.
Well, this is, I truly, and I mean this, I think we all are so thankful that you guys are out there doing what you do, because especially now when so many things are up in the air and so many things are uncertain, to have people like you who have the answers, who can at least help us find the answers, is such a gift. So thank you for your time today. Thank you for coming and spending this 45 minutes with us. Thank you to Rothman Orthopaedics for everything they do. Playbill, obviously amazing. I've been Nik Walker at Nikki Walks. I hope that you guys enjoyed, and have a great day, y'all. Bye.
Thank you so much for having us.
Life isn't made for pain. Life is for living. Don't let joint, back, or orthopedic pain keep you from doing what you love. Get back to what matters, because this is living.